Have you ever thought how much your mouth says about you? I've been a dental hygienist for 16 years. And every time you come in my dental chair and open your mouth, I don't only see teeth. I see how much stress you've been under, your immune system, if it's run down. I see also if you've had hormone issues, gut issues, and just nutrition deficiency as well. It's like a mirror to your entire body system. And I don't think a lot of people realize that, because I think in the medical field, they're doctors and they deal with gut issues, your heart, and then the dentist is your teeth. But the teeth are correlated to the entire body. So this is why I'm here today as a dental hygienist talking about biological dentistry. What is that? So many people are asking me, what is biological or holistic or whole body dentistry? I've been fortunate enough to meet some of the pioneers of biological dentistry from all over the world. I'm also going to have some of the top leaders in biological dentistry next as guests. One of them is Dr. Michelle Jorgensen, which I'm so excited. In mid-October, she'll be a guest to go even more in depth with her story as a dentist and now naturopath as well, and blending both. So what is biological dentistry? It's looking at your teeth interconnected to the whole body. So when I'm working as a dental hygienist for a biological dentist, we are not just asking how you're doing, looking at medical history, your medications. We're getting to your root cause as far as your stress levels, what's going on into your life. These are the things that we get the whole picture of your body. So here's some of the differences that a lot of people ask me for biological dentistry. We use ozone therapy. Think of ozone is a natural disinfectant for your mouth. So it kills all the bugs from viruses, bacteria, fungi, parasites. So this is what I use when I'm cleaning your teeth. We put ozone with the water. And so it flushes right into your gums as I'm cleaning your teeth. We also do ozone therapy if you have deeper pockets or periodontal disease. Some biological dentists as well will use PRP, which is using your own blood to help help your gums and periodontal disease. Biological dentistry also looks at oral infections and looks at how it's affecting your brain, your gut, and overall health. How do they do that? Sometimes they even do oral biome tests to check what kind of bugs you have in your mouth, because then we can really get to the root. Do you have parasites? Do you have an imbalance of a bacteria in there? This is so important because it's also connected to your gut health. So what's going on in your mouth will correlate to your gut and your whole entire system. Did you know that every tooth is interconnected to organs in your body? So if you have a tooth infection, it will be connected to another organ in your body and affecting that. So if you've been living with chronic illness, autoimmune disease, and you can't get to the root cause, oftentimes the last place patients will get to is a biological dentist that says it's coming from their mouth. Now, I'm not blaming the general dentist. My husband was a general dentist, and we had a practice just doing general dentistry. We only did what we were taught at schools. And why are they not teaching that at schools? I'm not quite sure, but I'm really hoping that will change, because this is the new age for dentistry where we're kind of blending root cause, the whole body system, with the teeth. And this is where I'm hoping that there's going to be more dentists open to learning to treat their patients as a whole. What I love about working for a biological dentist is that when we're seeing tooth damage from grinding, clenching, we're not only just going to prescribe a night guard. You know what the dentists ask? What kind of stress is going on in your life right now? Is there some past traumas? They give some ideas as far as doing breath work, meditations, something that will help their nervous system. They will prescribe that night guard, but let's get to the root to why there's so much grinding. And there's studies as well saying that grinding could be correlating to have parasites. So this is where the dentist is going to look at all aspects of your life. This is why I'm so passionate about sharing about whole tooth dentistry, whole health, holistic, whatever you want to call it. But here's what's kind of tricky, because now I'm only wanting to temp for biological dentists. I've come to realize not all of them are treating all the same, from their understanding with fluoride, cavitations, and root canals using ozone, PRP. There's no really regulations. So I'm also later on in the show, I'm gonna give you some questions you can ask your dentist, or how to find a biological dentist. You know what's really eye-opening? I was looking at statistics about amalgam fillings. Amalgam fillings are the silver fillings that are filled with 80% mercury. Now, mercury poisoning is a real thing in dentistry, and the statistics show that in the USA, 40 to 50 million amalgam fillings are placed each year. Now, this is so alarming, not only for the patient, but for the dentist. As I'm bringing this awareness to friends and family, this could be a root cause to some of their ailments or inflammation. Ultimately, to avoid disease, we want to reduce inflammation. And oftentimes it's coming from our mouth, metal in our mouth, from having root canals in our mouth. You know what's been so mind-blowing is that I've been a hygienist for over 16 years, and I never knew the amount of poisoning my husband as a dentist was getting every day, and myself and staff in the environment, my patients. I was in the environment where we were removing amalgam fillings, which are silver fillings, and so many people have them in their mouth still. But my husband was a cosmetic dentist, so he removed amalgam fillings for years. And now that I am more aware, amalgam fillings, silver fillings, are made with 80% mercury. Now think of the poisoning that he got on a daily basis. Did you know that stats show that there's 40 to 50 million amalgam fillings placed in the mouth each year in the USA? Now, some country, it's not legal. So this is where I just want to empower you as a patient to start asking more questions as to what's in your mouth and what it could be causing for your overall health. So it's just trying to educate you, as I, would see in the mouth so often where we kind of overlook the root cause. I would just go day to day cleaning, just all the protocol, even down to fluoride. Now in dental hygiene school, I was taught fluoride. I read all the studies, and it made sense to me. Like, okay, yeah, fluoride is what we need to heal cavities, to avoid cavities. I even was giving it small doses for my children, doing fluoride at the end of their cleaning. Now, more that I research about it and work with biological dentists, it is so toxic. And there's healthier alternative. For example, now my family, we've been using hydroxyapatite for toothpaste. Hydroxyapatite helps to remineralize your teeth. It can even from small cavities to reverse the cavity. Now think about that. How often do you hear that? And I know I may get some backlash from some dentists that I know, but I'm not sitting any more quiet of what I'm seeing when I work for a biological dentist. And I just light up the way they treat their patients. And I get really excited. I'm actually hoping that more dentists will be open to treating their patients like this because it just makes sense. It's the whole body. We're not just treating the teeth. This is correlated to the whole body. Just last year, one of my very good friends that I went to high school with, she had a heart attack. And you know where it all started? From an infection from a root canal. Now, this was the last place when she went to the ER and all these specialists, they couldn't even tie those two things together until later on. She found out the root cause. It was the root canal, who over time, think about it, it's a dead tooth. The dentist has removed anything that is alive for that tooth in there. And now it's just a dead tooth living in your mouth, harboring bugs, all sorts of them. And this might not be overnight where you start feeling anything because it's slow. It's a slow process. I know friends that got root canals when they were 20 years old, and now just at 40, they're starting to see more and more inflammation and problems that were rooted back from that. So I'm just finding that bringing awareness about biological dentists where they use CBCT scans to also look at some of these infections that might be rooted from root canals or cavitations. Cavitations are from removing wisdom teeth, and then there's an infection on the bone. And with Dr. Michelle Jorgensen next month, we'll go deeper into what the cavitations are and how she treats them. Same what she recommends for root canals. Most biological dentists do not do root canals. The option is to extract the tooth and put in a ceramic implant because you want no metal in your mouth. Think of metal. Metal attracts EMFs, right? Constantly. So if you have metal in your mouth, every time, now we have EMFs everywhere, our cell phones, going through the airport, all the scanners, everything has EMFs. So this is what attracts it, and it's in your mouth. You don't want metal in your mouth, and it attract more inflammation in your body. So this is not creating fear, and I hope this is not like so overwhelming. Oh no, I have, root canal and I have metal, I have this. Stop. Just one step at a time. One step at a time is maybe just starting to switch over from maybe mouth rinses that have alcohol in them, for example. Those mouthwash will strip away the good and the bad bacteria, and it will dry you so much. You don't want a dry mouth because your natural saliva actually has healing properties like good bacteria if it's in a great balance. So what you want to do instead of a mouth rinses that have alcohol and all these dyes in it and toxic ingredients is actually oil pulling. Now, you might think this is woo-woo and, this is not for you, but I'm telling you, coconut oil pulling. So you would grab a tablespoon of coconut oil, put it in your mouth, and swish it around. Now, you want to swish it around for about 10 minutes. And swishing around the coconut oil in there will help you rebalance, find harmony for all the bugs, the environment in your mouth. I call it the microbiome, the oral microbiome. This is so important to have the perfect flora in there so that you don't have gum disease, bleeding gums, and also you want to avoid for cavities. I have children too, and I know that the favorite snacks are always these crackers that stick on the teeth and cookies, and it's hard to get away from it all. But being able to do the coconut pulling, and actually my kids really like it and they think it's fun. You can do that 2 to 3 times a week, and make it fun. Maybe they can watch a show while they're doing it, or just implementing that in their day. Now, you want to spit it out in a napkin because the oils can clog your sinks or toilets and things like that. So spit it out on a napkin and throw it out in the garbage. Now, this will help tremendously. And as far as the hydroxyapatite, another thing that I want to mention, this is a natural teeth whitener, and it won't damage your enamel. So, and Dr. Michelle Jorgensen has a great product. Actually, I have it with me here. I've been using it the past month here. It's called a remineralizing tooth powder. So this has hydroxyapatite in it, and what you do is you'll dip your toothbrush in water, and then you dip it in this little powder, and you'll brush it. You'll put it all a small layer over your teeth, and then you'll brush your teeth normally. I love this one because it's flavored with orange, like citrus, and it will help remineralize your teeth. On top of it, make them whiter. So I absolutely love her new product. My kids love it as well, and it's clean ingredients, and it's just a great way to remineralize your teeth. I'll leave a link in the show notes for this product, but also you can look it up with Living Well with drmichelle.com. And if you want a discount code, put the word gratitude and it'll give you a 10% discount. I'm only going to promote anything that I personally use and have tried and truly believe and know the ingredients in, because I'm extremely picky. So I've been loving this product. So check it out. Now, I know this is a controversial topic, and I have a lot of friends that are endodontists. You may not like me when I talk about this, but are root canals. Root canals, like I mentioned, they harbor bugs. They're a dead tooth in the mouth. So I just want you to just be your own advocate. Think back as to when you had that root canal. Has it been giving you issues? Have you been getting infections? Have you noticed more autoimmune disease, more inflammation? Now, my husband was an expert at root canal. He was not an endodontist, but I remember him doing them often. But you know what I remember the most? Was the emergency calls on the weekend. So often he was a perfectionist. He would get every root. He was teaching other cosmetic dentists about his root canal skills. But guess what? Oftentimes, the infection would never leave. We'd have patients call and say, the infection is still there. It still hurts. There's still something going on. And it was really frustrating for him because he is a perfectionist and he knew he did everything he could, but he couldn't get to the root cause. But now that I've talked to so many biological dentists and educated myself on studies and research that is out there, it harbors bacteria. So no wonder the infection never left. No matter how much prescriptions we were giving them, no matter how many times that we check that the root canal was done well, the infection would never leave. So now this is where I'm connecting the dots and it's making sense. I'm just giving you that empowerment to start checking in your mouth and seeing if those might not be the root cause to your brain fog, your autoimmune, maybe even skin rashes, anything that more clenching and grinding. Another big thing that I've had guests on that talk about airway. Now, this is so important for anyone that has children that maybe have behavioral issues or always tired, or they're still bedwetting way past the year that they're supposed to be bedwetting. I had Dr. Michael DeLuke on a couple months ago where he talked about airway. I also had Dr. Nichols explain what that is and their protocol. We have done the same for my kids where they get a CBCT scan and it's so great. They give you a picture where they see the quality of oxygen that they're breathing in. Now think of how impactful the quality of oxygen we get in on a daily basis, just to make decisions in a day, just to feel energized. So think about it, how important that is to check that for your kids. So I highly recommend for every parent that there's a nudge going, something's not right, and you can't pinpoint why. Find a dentist, an orthodontist that is well-versed in airway. They'll do a CBCT scan on your child and see the quality of oxygen. For example, my daughter, she was in a green. She was perfect, whereas my son, still in the red. Even though we had done other protocols at our dental office in Wasilla for him since he was really young, it was still in the red, and we're still getting symptoms that I knew. I was like, I couldn't pinpoint if it was maybe gut health related, because we've gone down that path, as well as parasites and mold and heavy metals. So I was trying to weigh out, where is it coming from? Now, after a month being treated with Dr. Nichols, where my son has a spacer. So a spacer, what will help my son is widen his top jaw to allow the tongue to rest more, lower, and allow oxygen, better oxygen, quality oxygen in. So this is where I've already seen huge improvements in just 4 weeks. Now he's going to wear that spacer for about 6 months. Trust me, my son is 9. When he had it on, he was so scared. He did not want to do this. And I know that's so hard as a parent, because you don't want to hurt them and scare them. And you're like, oh, this might be too much for them. But think of the big picture. Think of the big picture, long run. The quality of life that you're going to give your child as an adult. Because think, if you don't get to the root cause now, think of sleep apnea. How many adults deal with that and have to sleep with this machine on, by their bedside with their significant other? And it's also the root cause to other chronic illnesses and diseases. So getting to the root when they're young, ideally, right away, like 3, 4, 5, 6, 7, 8, go see someone that does airway for them. If you are getting a gut instinct that something's off, it's normally the airway. So this is very important to check that as well. And for adults, same thing. They'll have protocols where you can do spacers as well and help you with your sleep apnea, brain fog, other ailments. Now, I know I've mentioned cavitations. Now, this is something also not many are talking about, but I think it's important to address it. Cavitation is when they remove wisdom teeth and there's unhealed bone, and it causes it to have an infection there as well. So oftentimes the dentist will have to go back and scrape some of that infection out of the bone. And this could have been the root cause to other chronic illnesses as well. What comes to mind, when I was in dental hygiene school, fluoride was the gold standard. When we had our dental practice in Wasilla, same thing. After every dental hygiene appointment, I do fluoride for everybody, and I believed it as well. But I found a great study now that I do not use any fluoride, and I wish there was no fluoride in our waters, and I know how toxic it is, and I really pray and hope that they will eventually remove fluoride for our drinking water and obsolete altogether. Here's a study that I found interesting. So in 2012, Harvard meta-analysis reviewed 27 studies, found that high fluoride exposures was linked to lower IQ in children. Now, these studies were not in the USA because USA doesn't want to do these studies. These are other countries, and so you got to wonder what it's doing neurologically for our children, and it's in our drinking water. So become aware of that and check some of the resources. I'll leave those in the show notes as well, or you can follow me at Melissa_Gratitude on social media. You can DM me. I can send you some of the research, and I will be talking more about that, having more guests as well that are biological dentists, or even I have now met so many friends and people that share their stories. I have this woman right now that she's going to share her story about her cavitation journey. I have a friend who's gone through root canal and then having her a heart attack. So these are all guests that I can share their own journey. And this will kind of open up your eyes and start looking inside your mouth for the root cause of possibly some of the symptoms that you're feeling daily. Okay, so now you're probably wondering, how do I find a biological dentist? Where are they? Trust me, this is extremely difficult because I know there's not a certification. And so it's really hard to know which ones are really doing all the protocols that I've talked about, and if not more. So here are some places that I noted down. So for professional affiliation is the IAOMT, International Academy of Oral Medicine and Toxicology, the IABDM, International Academy of Biological Dentistry and Medicine, and then the Holistic Dental Association. These organizations require training in safe whole body practices. So that could be where you start looking. As well, ask the right questions. Do you follow the SMART protocol for mercury removal? Now, this is important. Dr. Michelle Jorgensen will talk about this, what she does for herself as a provider and for the patient when she removes the amalgam fillings, because she even puts them in a detox while she removes them, because the exposure will be there. You'll get exposure to mercury when you remove it. You know, she even puts on an oxygen mask, like not just the mask that we wear working, but just those are some of the protocols. So she'll bring awareness to how toxic that is. And so this is a very important question to ask your dentist when you're removing these silver fillings. Do you test for Okay. Do you test for biocompatibility? Oh, I cannot say that. Okay. I cannot say this word. Help me out. Compatibility? Yes. I cannot say it. Biocompatibility. Biocompatible, yeah. Okay. Do you test for compatible? I can't say it. I don't know why. Compatibility. Biocompatible. Oh, okay. Can we use another word? What's another word? Oh, bioavailable. Yeah. Compatible. Compatible. Okay. Here's another question. Do you test for dental materials that are compatible? That's very important. What is your stance on fluoride or root canals? Because now here, this is where it's going to get tricky. You're not going to find a lot of dentists that are open and not doing fluoride or not doing root canals. So these are important questions. Do you screen for cavitations with cone beam CT? So this is a CBCT scanner that can see if there's infections in the bone. So you got to ask if they have that X-ray. Now look for collaborations. Dentists who work alongside naturopath, functional medicine doctors, or nutritionists that show they value whole body feeling. I'm going to say that again. Okay. Look for collaboration. So for example, a lot of the dentists that I know, not only have they gone to school to become a dentist, but they are also a naturopath. So they're just kind of blending both, which I love. I'm so fascinated by that because it really shows that they treat the body as a whole and understand, you know, your dentist will also be, or a dental hygienist, because I know I educate a lot about nutrition as well, how that affects minerals for your teeth and how to keep them healthy. And this is so important that I teach that, especially for the young patients, you know, which ones are the healthy snacks and not constantly sipping on your juices all day or your coffee. You want it one and done, you know, so it doesn't sit on your teeth and that's like acid on your teeth. Now, that's where dentists who are working with nutritionists as well, or functional medicine, so they can work together. Watch for some red flags. If an office is called itself holistic, but still uses mercury or pushes fluoride without questioning the warning signs, that should be a warning sign. Or, oh gosh, that should be a red flag is what I meant to say. Okay. Okay. Watch for red flags. Here's what I would think are red flags. If you go into an office that they call themselves holistic, but when you bring up cavitations, root canals, or just even the topic of fluoride, and they're like, well, that's a little bit woo-woo, that's a red flag to me. Find one that's open and well-versed about that and treats the body as a whole. Empower yourself to be your own advocate when it comes to your mouth. Don't be afraid to ask your dentist questions, like interview them. It's okay. A dentist that is really passionate about biological dentists and treating as a whole, they'll invite those questions and love that you're asking. So don't be shy to question your medical providers. Ask more questions, get knowledgeable, because that just empowers you. And that's really why I'm sharing all of this as I'm diving into learning more about biological dentists every day and how it's treating patients. Like, for example, even before I take x-rays, I ask the patients if they want to swish with iodine drops in water. I'm just trying to give you an understanding where there's a difference, where the dentist is treating as a whole body. When I'm going to work for a biological dentist, even before we take x-rays, they're going to not swish, but they are going to drink a little cup of water with some drops of iodine. Why iodine? Because that'll help our body from some of the radiations to help deflect it and protect our body. So these are all the things that I just so passionate about because I care about you. I care about health. I care about my own and my family and bringing that awareness. I have family members that I know they have entire mouth of metals and have had health issues since they know they were little. And I know that seems so overwhelming to start thinking about removing them at all, but can you imagine? What if your cancer went away just because you removed the metals in your mouth? Just what if? So it might be worth looking into a biological dentist that will treat you as a whole and look at some of your ailments. If you've been having new diagnosis of cancer or autoimmune, just ask to look in your mouth as well, because it could also be a contributor. I really hope you got a lot out of this and you have more questions. Please don't be afraid to DM me. I can direct you with some of the top pioneers of biological dentists that I know very well, and they can answer some of these questions even more in depth. I will also have biological dentists as guests that will be sharing their knowledge. Actually, I have Dr. Michelle, want to just jump on reading some of these books. There's one Dr. Michelle wrote. She has 6 books. It's called Healthy Mouth, Healthy You, Holistic Dental Guide. You can find all of these on Amazon. Her most recent one is Living Well with Dr. Michelle. And I love this one because it's not just for the mouth, but the whole body. And the way she treats the body is through seasons. And I really love that. So I'm really excited to have her on. But there's other pioneers as well in the biological dentist that I can connect you with. So just DM me and I'll put links in the show notes as well. Please subscribe, send this episode to anyone that you might know might be dealing with something inside their mouth. Thank you.